Hello, I'm Alina Schnake-Mahl. I'm a postdoctoral research fellow in the Urban Health Collaborative at the Dornsife School of Public Health at Drexel University. Today I'm going to tell you a bit about our article entitled Evaluating Indoor Dining Closures and Reopening on COVID-19 Rates in Large U.S. Cities using a Quasi-Experimental Design. So throughout the COVID-19 pandemic, there's been a patchwork of city, state, and county decisions around policies enacted to prevent the spread of COVID-19. Though prior research has examined the impacts of other policies, such as eviction moratoriums, mask mandates, and stay-at-home orders, there's been less research focusing on indoor dining policies. So here we specifically focus on indoor dining policies at the city level during the spring and summer 2020 period. But we don't just examine cities that reopened dining compared to cities that stayed closed. Instead, we leverage government preemption. And government preemption is when a higher level of government prohibits or limits a lower level of government from enacting a program or policy. And this has been employed by states throughout the COVID-19 pandemic to limit local government from enacting various local policies aimed at protecting public health. So here we're leveraging this variation created by preemption of indoor dining policies to compare cities that kept indoor dining closed to cities that would have kept indoor dining closed, but were preempted from doing so by their state. And then we examine the association between keeping indoor dining closed and COVID-19 incidents using a quasi-experimental design. We ran a difference in difference model, controlling for other city-level time-varying major public health interventions, end of stay-at-home orders, mask mandates, lifting eviction moratoriums, and we run negative binomial regression models with city day as unit of analysis, city population as an offset, and robust standard errors clustered at the city level. We also do a number of sensitivity analyses, including running an event study model, changing lags in study periods, adding fixed effects, excluding various cities, adjusting for pre-treatment sociodemographic characteristics, and using an alternative modeling approach for staggered policy adoption and treatment heterogeneity. We ultimately include 11 cities in our analysis, among the largest cities in the country. And we find the case rate trends approximately parallel in the pre-treatment period. So ultimately, we find that keeping indoor dining closed was associated with a 55% decline in new COVID case rates over 6 weeks, compared with cities that reopened indoor dining. Our findings don't substantively change in our sensitivity analyses. So there are a number of limitations to our study, and briefly I'll mention that though we employ a strong counterfactual proxy using that preemption concept, there are possibly other unmeasured or time-varying between city factors, such as the timing of other policies, that may bias our estimates. So ultimately, we find in this study of 11 large cities with over 22 million inhabitants that keeping indoor dining closed was significantly associated with reduced COVID-19 incidence. Cities, states, and countries are actively making decisions around indoor dining and other strategies to control COVID, particularly given the spread of Omicron. And in this article, we present robust evidence that keeping indoor dining closed is one tool to prevent further spread of COVID-19. Thank you so much.